Tears of joy. Oh, Tina, you need a big hug. They're feeling better? That's awesome, girlfriend. What do you notice? What's the biggest change that you notice?
I'll take a hug, honey.
Sorry.
That's awesome. I'm so happy.
Sorry, I don't mean to.
No, no problem. Good stuff.
Less pain?
Yeah, no pain. None at all.
Wow! All right, we're here today with Tina, and Tina's about to get started with Dr. Davis for the non-surgical operation for the knees. So, Tina, tell me, what's been going on with those knees?
Just had problems with them since high school, really grade school, playing softball, basketball.
So you did a lot of sports?
Yeah.
Okay.
I just got hit in the legs and the shins and the knees with balls, so I was a catcher.
So over a period of time, yes, it's taken the toll on those knees.
Right.
Okay.
So,
have you seen any other doctors?
yes, quite a few doctors. I've had this knee scoped twice for a meniscus
Okay.
tear. And then this one I've had a meniscus tear and a partial ACL tear.
Oh, wow.
Yeah.
Wow.
So that's it, though. That's
Okay.
not bad, but I mean, that's it.
So let's talk about your discomfort level today. What is that discomfort level in those knees? 0 being no discomfort and 10 being unbearable.
Well, I think because it rained last night, that's what's making this one flare up so bad this morning. So we're about at a 7 or 8 on this one left.
So the weather has a lot to do with it.
It does, yes. And the reason why, one of the reasons why we moved down here, was,
Get away from the cold?
Yes.
So the cold really affects it too,
yes.
huh?
Right,
Okay.
it makes it worse.
Yeah, that's not good. Okay. All right, I'm going to have you stand up for me. Now, Tina, where did you feel the discomfort from going from sitting to standing?
Just right here in the front of my knee.
Okay.
And same thing, it's real tender, real sensitive right here.
Okay.
This morning.
Okay. All right. 2 steps forward, Tina. All right. With feet shoulder length apart, arms out in front of you, and I'm going to have you squat down for me. And where did you feel it there?
Same thing.
Same
Always
spot?
right here in these front.
More into the inside there. Yeah, I see what you're saying. Okay. All right. So holding onto the handrail, I want you to go down the stairs for me.
Oh, well, I have to go sideways.
That's fine.
Okay.
That's fine.
Because they just don't.
So that left knee is worse than the right. So
Yes.
it's easier for you to keep that left leg straight.
Right. This is the strongest it's always been.
Okay.
It's the newest knee surgery.
Okay.
You see what I mean? This one's been scoped twice for a meniscus
Right.
tear.
Right.
And this one only once.
I see.
Yeah.
Okay. All right. We're going to go back up the stairs.
Same thing.
Okay.
It could probably go, but it's a lot weaker.
Okay. So you also feel weakness in that leg.
Yes.
Okay. So which was more, out of all the exercises we just did, which one caused you the most discomfort?
Going down.
Down the stairs? Okay. All right. So I know we went over a couple things, couple goals that we want to go over with you. And one of them was to be able to get out and walk your dogs.
Yes, just to walk the dogs.
Right. Without any discomfort or anything like that.
I don't expect to be jumping around playing basketball or doing high aerobics activities, nothing like that. Just walking the dogs.
And you just want to get your normal life back.
Yeah.
All right. Well, let's get started, Tina.
7. Deep breath and pull. 1, 2, 3, 4. Breath and pull. 1, 2, 3, 7. Okay, good.
In the hallway and back.
I keep wanting to walk the way I used to walk.
Yep. There you are. Swing them arms. You're going to take monster steps now. Ooh, how do you like that? Tears of joy. Oh, Tina, you need a big hug. They're feeling better? That's awesome, girlfriend. What do you notice? What's the biggest change that you notice?
I'll take a hug, honey.
Sorry.
That's awesome. I'm so happy.
Sorry, I don't mean to.
No, no problem. Good stuff.
Less pain?
Yeah, no pain. None at all.
Wow! All right, we're back with Tina, and Tina's finished her first treatment with Dr. Davis. So Tina, can you stand up for me? And how was that?
Oh, it's good.
Much
Great.
better than before? Okay. Take 2 steps forward. Let's try that squat. All right, yep. Arms out in front. How low can you go? How was that?
It's good. Yeah, much better.
All right, now the stairs. The stairs is what give you the most problem. And we're gonna try to do it just 1 step or 1 foot per step. Try it.
I'm still not used to going downstairs with 2 feet.
You know what? You're gonna have to practice because your brain still thinks that it
Yeah.
has to put 2 feet per
I know,
step.
I'm feeling so good, I just don't want to mess it up.
Absolutely.
I'm afraid to stretch it too far.
Absolutely. Let's go back up the stairs. This is going to be part of your homework. Do you have stairs that, see, going up the stairs you can, but it's just going down those stairs, and this is going to have to be something that you practice
Okay.
because your brain keeps thinking that it can't do it, but it can. And generally, I have patients just start with 1 step.
Yeah.
Start at that bottom step and then try to use the other foot and just use that same step over and over again until your brain's like, oh, I can do that. All right.
Brain needs to get knocked in the head.
So what is your discomfort level now, Tina?
Maybe a 2.
That's awesome. We
Yeah.
haven't even done therapies yet.
Yeah.
Are you happy with today's
Yeah.
results?
Yes, very much.
All right, let's get you on therapies.